guys, so I am back again with another video about mental health, talking about my mental health and giving you the down low on some simple facts about different mental health problems that I suffer with. And today I am going to be talking about depression. I think depression is really misunderstood within our society. I think it's really difficult to try and dispel stigma around something that is so commonly talked about. You know, it's really common to hear somebody say, "Oh, I feel really depressed today," and they don't. They feel sad. But I mean, that's the problem. People think depression is feeling sad, and it's just not. A lot of the time when I'm really depressed, I don't feel sad at all. I feel nothing. I feel nothing, like an overwhelming sense of nothingness that kind of becomes a sense of despair, but it starts off with nothingness. And even when it escalates to the despair, there's still no sadness. It's fear and isolation and just terrible, terrible heaviness, but I'm not sad. It's very rare that when I'm depressed I actually feel sad, and it's very rare that when I'm depressed that I cry, because I cry when I'm sad. But depression isn't sadness, so I don't cry. Something that I found with my depression, and I find it really difficult, is the lack of understanding within society. Especially after I had my children, people will tell me, "Why are you still depressed? You have two beautiful children, you have a family, you have all these amazing things. Why are you depressed? You shouldn't be depressed." And then they kind of think that I don't love my children, or that I'm not grateful for what I have. But I am so grateful, and I love my children to death, but children don't cure depression. Nothing cures depression in a way that, you know, you can get something, like get a new job, win the lottery. You can have everything in the world, but it won't cure the fact that you're depressed. Depression doesn't work like that. My depression manifests itself in different ways. Sometimes I can barely function, and that is when it hits me hard, and that is when I get to the point where I am overwhelmed and not coping. And you know, I can barely function. I suffer from an overwhelming sense of passive suicide, which is where I am definitely suicidal, but I would never hurt myself. And that's how I've been even recently within this relapse. I suffered from a lot of passive suicidal thoughts, where I kind of wanted something else to kill me, but I would never act on impulses or suicidal thoughts, because I love my children and I don't want to leave them. But you know, I'd feel like, well, if a train hit me, or if a bus hit me, or I'd think, like, we'd be driving in the car and I'd be like, you know, if someone smashed into me on this side at this angle, the children would be safe, but I would die. And it's kind of like that. I have a lot of, at bad times, when it gets bad, that's how bad it gets. I'm constantly wanting to not be alive anymore. And the fact that I am alive is devastating to me, and I will wake up and cry because I've woken up that day. And that is how bad my depression gets. I mean, in the past, before I had children, I had several suicide attempts, especially during my nervous breakdown. I think I tried to kill myself 7 or 8 times during like a year stretch. So it gets pretty bad. A lot of the time I feel really guilty about being depressed. In the same way, and for the same reasons that people tell me that I shouldn't be depressed, I feel guilty for being depressed. I have an amazing life. I have a beautiful house. I have 2 beautiful, amazing children. I am training to do a career that I'm really passionate about. And yet, sometimes, I don't want to be alive anymore. And I feel guilty. I feel so guilty. And I carry the burden of guilt about my mental health with me every day. Because what kind of mother wants to leave their children? But it's not always, you know, doom, gloom and death. Most of the time my depression is like walking through a fog. It's like I view life as a journey, and so a lot of the time I refer to myself and my life as a car, because the best way for me to describe what's going on in my life is to kind of describe how my car is running. And with depression, it's like I'm driving along and I'm like having a good time, I've got some music on and I might be dancing and blah blah, and I'm like, oh hey, I'm going to take a shortcut because why not? Or, oh look at this really scenic route that I'm going to go down, and so I turn and suddenly I shouldn't have turned and the fog sets in and it's a really heavy fog and I can see the road that I was on, and that's where all the other people are, and so I can see everybody else in their cars moving at a normal speed, and I can see the next lane across where people are moving really fast and they must be pretty manic or just, you know, really productive people. But I am in this road, like a side road or something, that is in dense fog where I am moving so slowly and it's kind of suffocating and heavy and I can't move. I can barely move and I have to drive so slowly because I can't see and it feels awful, and it's a kind of damp fog, so it kind of gets into my lungs and it makes me not be able to breathe and it makes my chest feel really heavy and I'm lost and I don't know how long this road is until I can turn off back into the normal lane. And that's what my depression feels like, a heavy weight that sits on my chest that obscures my vision because there's something sitting on my chest. It stops me breathing, it fills me with fear and anxiety because I don't know when it's going to end and I can't see what's ahead of me, and it's just there and it exists and I can see everybody else living their lives and moving along and I am barely able to breathe but expected to live my life. Because this is the thing, when I have an episode of depression I can't just stop. When I have an episode of anything I can't stop. I had the worst relapse of my whole life last year. I almost died but I couldn't stop. I was still doing the school run 4 times a day, I was still cooking 6 meals a day because, you know, 2 children times 6, sometimes meals for Harrison as well. I was still doing dance lessons every Saturday, I was still doing football lessons, swimming lessons, hydrotherapy, doctor's appointments. I was still doing everything because you can't stop. And with my depression it sets in and I can barely get out of bed. I sit in bed for hours because I don't sleep. Depression makes me so tired, but it brings insomnia with it. So I sit in bed for hours, haven't been sleeping, exhausted because I just want to sleep. And then it gets to the time for me to get up and I can't. I dread having to get up. But you have to, because what are you going to do? You can't say to your children, oh hey, sorry, mummy's depressed today so I'm not going to get out of bed, make your own breakfast. You can't say that. You can't do that. And so in the end I have to get up. Before I had my children I didn't get up. Before I had my children sometimes I would stay in bed for days, literally days, and not move, barely move. I'd go to the toilet. Normally my mum would bring me a drink because she would be like, you need to move, and I'd be like, I can't, it's too much. And that's how most of my depression goes. I'm in a car and suddenly I can't see. Something that I struggle with when I'm depressed is self-care. From basic things like brushing my teeth and washing my hair to, you know, the things that I know make me feel good, like painting my nails or doing yoga, which I do there, or I do it downstairs. I really struggle to do all of it. I struggle to, you know, there have been times when I am so lucky that I have curly hair that doesn't look greasy even when it is a mess, because there have been times when I haven't washed my hair for a month because I've meant to, and then it just feels so overwhelming to do something so simple that I don't and I can't. And that's what I find so hard. Sometimes it is so difficult to just do basic things. Brush my hair, wash my hair, brush my teeth, get dressed. It's so difficult. Sometimes I have worn the same clothes, literally the same t-shirt, I have worn it 5 days in a row, including sleep. Because I just can't, do anything else, and getting changed, changing a t-shirt and finding another t-shirt that is comfortable and fits is such an overwhelming task that I can't do it. But I found now that actually forcing myself to do this, forcing myself onto my mat, forcing myself to do my nails. I have a really elaborate skin care and hair care thing at the moment because I'm growing my hair, and I broke out, I don't know whether you can see, but I broke out for like the first time in my life. I'm sure I've said this in like every single video I've made. But so now I have this really elaborate skincare routine, and forcing myself to continue to do it, even when I'm depressed, is actually quite helpful. It's only now, after about 10-15 years of dealing with depression, that I understand that actually sometimes I have to force myself to do things in order to not get to the point where I want to die. Like, because that's what happens. I very rarely go flat out of the blue wanting to die. It's very much a journey, but it's a learning process. I think, as with anything, it is a learning process. I have had a long time to learn what I have to do when I'm in that place to try and keep myself safe. And it's only through trial and error that I have learned what I should do, because sometimes forcing myself onto my yoga mat makes my yoga mat a really terrible space for me to be in, and it does more harm than good. And so I've had to learn when to do things and when to answer what call and what to challenge and what not to challenge. And it's taken a hell of a long time for me to get there. And when I think about it, it's actually scary how long it's taken me to find out, because with depression you don't know how long that you've got. Like, when it's really, really bad and it's overwhelming and you want to die, I mean, I'm lucky, my suicide attempts weren't successful, and so I'm here and I have this life and I have my children and I'm learning how to deal with my depression. But at that point I didn't know how to deal with my depression, and so I tried to kill myself. And it's scary that people get to the point where they try to kill themselves before they learn how to deal with it, because it takes so long to learn, because it is so hard to fight the negative urges that you experience. So that is me. I think that's pretty much all I can tell you about my depression without getting really, really long-winded and doing more harm to myself than good, because it is difficult and quite triggering talking about something that has affected me so negatively in a lot of detail. And plus I don't have that much time and you don't have that much time, so we will move on to the part of this video series that is, what is depression anyway? So depression isn't feeling sad. A lot of the time people say, I feel depressed, when they feel sad or they feel a bit low. But normally those feelings pass. And if they pass, you're not depressed. You're sad, you're feeling a bit low, that's not depression. But when the feelings don't pass and they persist and they start to interfere with your life, that is when you should go to a doctor, because that is when you can be diagnosed with depression. In its mildest form, depression can just mean low spirits that are persistent and come back and return on a constant basis. But in its aggressive form, that's when you get diagnosed with clinical depression, and that can be genuinely really dangerous, because that is when people start to completely shut down, not be able to deal with their lives at all, and consider suicide, and of course sometimes die. There is a couple of symptoms that you can look out for that are common within depression. Of course, your mood feeling low, feeling helpless, feeling in despair, feeling tearful a lot of the time. A lack of sex drive is quite common in depression as well. You can find yourself not engaging in social activities like you used to, not enjoying the things that you used to enjoy, and also having a really short attention span, not being able to concentrate on the things that you should be able to concentrate on, like TV shows, movies, and work. People who suffer from depression also have trouble remembering things and thinking about the future, and have a lot of negative thought processes about themselves. So they feel a lot of guilt for feeling depressed, they feel a lot of guilt for all sorts of things that they do and don't do, or what they deem themselves to do. And they have a real sense of negativity about the future, feeling despair, feeling like, you know, what's the point? What is the point in trying? And then, of course, suicide. People deal physically with depression in kind of opposite ways. Some people can't sleep and have real difficulty sleeping to the point where they get insomnia. Other people sleep a lot. One thing that's common is that people with depression are tired all the time because depression wears you out. Some people with depression lose their appetite and lose weight. Other people with depression eat a lot and gain weight during depressive episodes. It's something that is common with depression, with whatever your physical symptoms are, is that they're very black and white. You either don't sleep at all or you sleep all the time. You either hardly want to eat or you kind of, binge eat because you're depressed. It's very black and white in how people physically deal with depression. People often start abusing drugs and alcohol when they're depressed, as well as smoking more. Anything to kind of numb or take away the pain. And a lot of the time that means substances that they either didn't use before or used very little. Depression is also closely related to anxiety. A lot of people with depression will also feel very, very anxious and develop some form of anxiety disorder, generally because depression stops you doing so much that it's very, very difficult to fight it, and you end up kind of in a battle with yourself and with your mind on knowing you need to do things but just not being able to, and that breeds guilt and of course anxiety. When people get severely depressed, they may also experience psychotic experiences, so hearing voices, seeing people in the shadows, lots of delusions, and they're things that generally people don't share, because saying that you're hearing voices, people start to think you're nuts, and that is the last thing you need, because depression isolates you enough already. And so psychotic experiences are things that people generally don't share, and they can be incredibly, incredibly scary to somebody who is already severely depressed. As time goes on, a lot of people with depression start to experience suicidal thoughts, feeling that what is the point? Where is their life going to go? What is the point in anything? And they may as well just die because they are so unhappy and overwhelmed with their life and their depression. There are different things a person can do to help themselves when they have depression. The first step is to really use self-care, look after yourself, fight those feelings that are telling you that you're not worthy, and they're telling you that, there's no point in life, there's no point in you doing these things because there's just no point. Have a shower, have a bath, make sure you're eating, try and sleep, maybe stretch, go for a walk, do some yoga, whatever it is. Watch a film, do some colouring, anything that you used to enjoy doing. Physical activity is really helpful, fresh air is really helpful, and being clean and fed can do wonders on days when life is overwhelming. And it can be very difficult to make that first step, but it is such an important step to make. Connecting to other people is also really, really important. Depression makes you want to isolate yourself, and it makes everything really, really overwhelming. But it's been clinically proven that along with physical activity, being social really, really helps when you're depressed. And even if your mood is only lifted for the time that you are with other people, it is worth that 20 minutes, hour, 2 hour, 5 hours to not feel the crushing depression that you could be experiencing. And of course, the most important thing that I think people should be doing is reaching out for help with your doctor, with your GP, with whoever you can, with your social worker, with your teacher, with colleagues. Reaching out for help is so important with managing depression, because once you get help, you can get therapy, there are medications you can take, and you can work with your doctors to figure out what is best for you. Some people just take medication, some people do a combination of medication and therapy, some people just have therapy, and you can work through what works for you and find out how best to look after yourself and to fight the depression that is stealing your life and stealing your happiness. It can also be really difficult for family and friends of people who suffer from depression, because watching somebody that you love just tear themselves apart and not be able to function because they're so depressed is incredibly difficult and incredibly sad to watch. And sometimes you can feel really helpless, because how do you help somebody who is depressed and who has retreated within themselves? But there are ways that you can help. The most important thing that you can do is encourage the person to seek the appropriate treatment for their depression. And while they're doing that, you can encourage them to talk to you or to somebody else about how they're feeling and how they're doing, not letting themselves do this completely alone. Also, not blaming them for their depression or how it makes you feel. They feel bad enough already without having to carry the guilt of how they know they're making you feel. If they live alone and they're very isolated, trying to visit them and making sure that they're not alone physically is also very important, because depression strips you from so much, and it also makes you want to isolate yourself, as I said earlier. And so, you know, imposing yourself it seems inappropriate, but it actually can be really helpful. I know that for me personally, my mother really, when I was really struggling, my mother kind of invited herself round and would say, right, we're coming for lunch, we're bringing this food, and I would just be like, I don't want to do this, I don't want to do this, I don't want to do this. But actually, the times when my mum and my sister came over, it was like a break from my head, from my depression, from the fear and overwhelming feelings. And so imposing on somebody will seem inappropriate and wrong, and sometimes it is wrong, but for the most part it can be incredibly helpful. If your friend, relative, whoever has episodes of depression, it can be worth learning what their triggers are, so you can help them avoid them and you can help becoming a trigger yourself. And also be patient. If somebody has started treatment for depression, just remember that they won't be cured straight away. That's not how mental health works. So be patient with them, and in time they will move forward and it will get easier. Friends and family of people with depression, is also really important to look after yourself too. Be aware of how their depression makes you feel and combat anything negative that happens to you. If it makes you worry, say that you're not eating, make sure that you are eating. If it makes you depressed because you suffer with depression too, figure out, you know, why this is a trigger and what you can do to help yourself. And sometimes that means that you have to step back. But communication really is the key, and communicating with themselves and communicating to your inner voice and just figuring out what you need, how you feel, and looking after yourself, because the best way to look after somebody you care about is to look after yourself as well. So what I'm going to do, I'm going to pop a load of links, more than I've ever popped, like this, in the box down there, for links about depression, services that can be helpful, because actually depression is something that there are so many resources that can help people. And so I'm going to pop as many as I can in the little box down there, and hopefully if you're watching this and you need some help, or you're watching this and you know somebody who does need some help, some of these resources that I'm going to link you to are helpful. So watch out for my next videos. I've got 2 left to do, I think, one on anxiety and one on body dysmorphia, and I think that's it. So yeah, they'll be coming soon, hopefully by the end of the week, which gives me, like, you know, 6 days. So yeah, watch out for those, and in the meantime, stay safe, stay loved, and look out for the light.